Hi, I'm Allie and I'm here with Nikki and Norman, and today we are talking about how we conceptualize eating disorders at Reasons. So I think that in our field and even in society in general, we're often talking about eating disorders and what they are, and a lot of times I feel at least that there's a lot of misconceptions about what they are, or people talk about them in a way that actually isn't very accurate.
One way to look at it is that there's the primary piece of psychological pain or anxiety, and then the secondary piece is how that manifests in disordered relationship with food, body, weight, and so addressing both of those things at the same time, because both of those things make up what an eating disorder is. If we look at eating disorders as a search for wholeness and meaning, that especially around this concept of wholeness, then that means that it's including the body, the brain, the spirit, the soul, kind of all aspects, the personality, all aspects of the person. And so approaching it like that, I think, combines these two.
I also think that's why you need a truly multidisciplinary team. You need people coming from lots of different disciplines, because we do have the body pieces and we do have the internal pieces and the psychological pieces and the systems pieces that we have to work with, and you can't sort of pick one or the other.
What would you say to somebody who, maybe like a family member who has seen their son or daughter really struggle and feel really out of control to them, and like them be really fearful of the behaviors that they're engaging in?
It's a really difficult position to be in. Educating families is then really, really important. Their loved one, whether it's their partner or child or whomever it is, they're here immersed in this environment where they're getting education all the time, and they're getting feedback from people all the time, and the families aren't with them through that process. And so a big part of it really is that kind of education and helping them understand what this illness is, and helping them also go beyond just what the behaviors have been and what the symptoms have been that really are impacting their loved one's life. Most of our patients have talked about sort of this feeling of that they've had for a very long time, before even the eating behaviors started or the disorder behaviors started, this profound feeling of just, there's something wrong with me and I don't fit. I don't belong anywhere. And so to find a way to address that very directly in treatment, I think, is extremely important. When we design challenges for people to address whatever the avoided thing is or whatever the feared thing is, a big part of that is setting them up for some level of success, so that when you have a lot of successes moving forward and every day and multiple times a day, hopefully what that generates is a sense of hope for the patient, that I can then go out there into the real world because I've been exposed to it already.
I think that's the attitude of our team. When people come in the door, the attitude that they're greeted with is one of confidence and a belief that they can do all of the things that we're asking them to do. So I think the community and confidence in addressing those challenges are the two things that come to mind for me, that I hope when people leave here that they have had that experience and carry that with them.
Yeah. Thanks, Nikki and Norman, and thanks for watching. For more information, please visit reasonsedc.com.